Good evening. Welcome and thank you for joining us for another installment of Ask the Doctor series. I am Tracy Hill of Arc of Knowledge, a nonprofit organization that provides resources toward building and strengthening relationships between our generations. As part of our generational health and well-being initiative, Arc of Knowledge and Centerpoint Baptist Church have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. Our presenter today is registered nurse Amy Swoboda. Amy was originally studying to become a biologist when her significant other developed kidney failure. While being trained to care for him, Amy decided to return to school and study nursing. After graduating, she began her career as a stroke or neurosurgery nurse at MedStar Washington Health Center. Amy enjoyed learning about the brain and caring for acute stroke patients. She later transitioned to Luminous Health Anne Arundel Medical Center as an observation unit nurse, where she quickly became a stroke champion and an active member of the hospital-wide stroke committee. In 2020, she became the clinical educator for the neurocare unit and helped train new nurses on stroke and patient care. In 2023, Amy accepted the position of stroke program coordinator for MedStar Southern Maryland Hospital. Please welcome registered nurse Amy Swoboda.
Well, thank you, everyone. Thank you for that really nice introduction. So my name's Amy. I am currently the stroke program coordinator here at MedStar Southern Maryland Hospital Center. I started at the end of November of last year. I'm really excited to be here. I am very passionate about stroke and stroke care. So hopefully everyone will learn a little bit something new today. And I'm really excited to hear what others have for questions. So let's start. The agenda for today is we're going to figure out what is a stroke, signs and symptoms of stroke, common treatments for stroke, how to decrease your stroke risk, and what happens after a stroke. So I really love this video here for stroke recognition, the impact of stroke. One of the things I think a lot of us think is that, oh, stroke happens to someone else. I could not be that kind of person to have a stroke, right? I eat healthy, I do all these things. And you know what? It's not always that. There's a lot of reasons why people have strokes, and it's not necessarily always obvious. So recognition of stroke symptoms is incredibly important. And we're going to be going over these different signs and symptoms, but I want you all to think about BFAST as we go through this presentation. And of the essence, time is critical. I can spout out different things. Almost 2 million neurons die each minute a stroke is not treated. What's also devastating too is that once a stroke is completed, the brain can age almost 36 years. So really, when we talk about stroke, we really have to think about not just what are the signs and symptoms of stroke, but calling 911 and getting that person treated as fast as possible. So what are we going to be talking about today? Like I said, what stroke is, the signs of stroke, common treatments, and how to decrease your risk. So this is, again, this is a really important visual. And I think as you look at this video, take a look and see what you see in this person.
Before my stroke, I had a great basketball career. I was averaging 30 points, 18 rebounds, was ranked top in this area in the United States, actually. I got over 40 scholarship offers, Division I schools, chose the college and had a great time there playing basketball, being ranked, being a captain, lead scorer, and being recruited to play professionally. But I had some health problems that came about. Approximately the next season, I woke up for preseason workouts, getting ready to do running and get in shape. And suddenly I lost feeling in my arm, in my leg. I could no longer talk. I could no longer walk. I was having a stroke, but I did not recognize it was a stroke. My name is Latia, and I had a stroke when I was 21 and a star basketball player at a Division I university. Currently, I am an educator, a mother, a basketball coach. I love everything that I do. I teach in a school that I coached at, and I coach at a high school. I'm a varsity high school coach in Maryland. When I share my story of me having a stroke and my health history, I always say, one day I was a star athlete. One day I was running, jumping, shooting. I was an amazing athlete. The next day, I can no longer walk. I can no longer talk. I can no longer move. Put forth 100% at anything you do in life, and whatever goals you have, put forth 100%.
Okay, great. I hope everyone was able to see that and hear that. My apologies for all the technical difficulties on my end. And can everyone see my screen better now? I hope.
Yes, ma'am.
Awesome, great.
Yes.
Thank you very much. Okay, so moving forward, again, so what you're seeing here, okay, is this dark red, these states here, okay? So the southeastern United States, and then that outline in black is what we call the stroke belt. And what's surprising is Maryland is actually not considered part of that, but I'll go into a little more detail in a moment. So again, you know, this area they've found in the whole United States has the highest stroke prevalence, with Alabama being number one. So as I had mentioned, this shows us a different way, right? So stroke is the leading cause of death, fifth leading cause of death in the United States, and the number one cause of adult disability in the United States. Here in Prince George's County, with almost 1 million residents, stroke is the third leading cause of death, as well as the third leading cause of death in the state of Maryland. So the thing is that PG County, the residents are at a higher risk of stroke due to some intrinsic factors, particularly high blood pressure and diabetes. And here at our hospital in Southern Maryland in 2023, we treated over 500 stroke patients. A little more than half were female. We have a young stroke patient population with a mean age of 68 years old. And every year, our patient stroke volume is increasing. For the first quarter, we've already treated over 100 stroke patients. So what is a stroke? And I hope you can appreciate after that video finally played that that you could tell a little bit like slurring of her speech, the way she was taking her words out and speaking, there was a little delay. And hopefully you'll understand as I go forward. So stroke, what is it? It's a brain attack. Like a heart attack, it's the same thing, except happening in the brain. It's a medical emergency. It happens when blood flow to the brain is interrupted. And when that happens, that part of the brain can't get that oxygen carrying blood to that area of the brain, and the brain starts to die. And as the brain dies, that's causing permanent brain damage. So symptoms that a person can have when suffering a stroke are a result of the area in the brain that's actually affected by that interrupted blood flow. And while I'm not going to quiz you guys on this later, what I'd like for you to appreciate is that a lot of great researchers figured out that different parts of the brain here have different functions. And that when you come to the hospital, nurses and physicians will be assessing you to try and identify very quickly, you know, are the things that you're presenting with, are you having coordination issues, strength issues, sensory issues? We'll be doing all these tests on you to have an idea as to where potentially that insult to your brain is occurring. So there are two main types of strokes, ischemic and hemorrhagic. Ischemic, I like to always have an analogy to like the plumbing to your brain. This is the pipes that are going to your brain and perfusing your brain, and basically there's a big clog in it. And so that area after that clog can't get any of that blood past it. And that's what happens in ischemic stroke. It's the most common cause of strokes. 87% roughly are these types of strokes. Okay. And the other kind is what we call hemorrhagic, or a bleeding stroke, where there's a weakened area of a vessel in the brain and boom, the blood goes leaking out. This is commonly because of a type of vessel malformation, but it can also be caused by other factors. But typically when you say, oh, I'm going to have an aneurysm, it's something like that. It's a weakening and ballooning out of the blood vessel in the brain, causing blood to spill out into that brain tissue. And while it only accounts for 13% of strokes, it's actually more deadly typically than an ischemic stroke. So again, an ischemic stroke, right? 87% of all strokes caused by those clots. Typically that clot travels somewhere else in the body, or because fatty deposits in those vessels have occurred and built up, eventually blocking that, that vessel. Now, a TIA is what we call a mini stroke or a warning stroke. And it's the same. Sorry, I just saw this. TIA is considered what you were saying is ischemic. Yeah, so TIA is a type of ischemic stroke. But what happens with a TIA or transient ischemic attack is that clot, your body actually is able to push that clot out and restore blood flow to the brain. So what you end up seeing in a TIA is someone who has stroke symptoms, and when we investigate further, we don't see any permanent damage in the brain. And so what we end up considering is that is a TIA, and that you had stroke symptoms that resolved fairly quickly, and we presume it was a TIA. So it's just that it's a transient clog in your arteries that your body is able to push it through. The challenge with TIA is that we can call it a warning stroke, because if there's other risk factors that you have, a TIA can be a predictor to having an actual full-blown ischemic stroke where that clot cannot be pushed through, and you end up having brain tissue dying past that clot. Thank you, Christy, for asking the question. So what are some of our risk factors for ischemic stroke? I always like to call it the trifecta: diabetes, high cholesterol, high blood pressure. Those are the three biggest risk factors for ischemic stroke. Diabetes and cholesterol contribute to affecting that vessel and whether or not you're going to have fatty deposits here. High blood pressure can weaken those vessels and cause little nicks in those vessels to cause like a clot to occur. Like when you get a cut on your finger, your body tries to heal itself and causes a clot there. It's the same sort of thing. Constant high blood pressure. Atrial fibrillation is a heart condition that predisposes you to clots. Types of heart disease, obesity, and obstructive sleep apnea. All right, so ischemic stroke survivors, there's been a few. And again, I'd like to see what, I'd like to show you what I'm seeing here. So, okay, Roberta Flack, some of us may know her, right? American singer-songwriter. She suffered a stroke in 2016. And the unfortunate reality is that she's ended up having a lot of other brain disease complications. She actually has ALS, which is a really devastating neurological disorder, typically unrelated to stroke. For those younger and younger than me, Hailey Bieber, she actually had what we call a TIA. And when they went and investigated further, they found that she had a hole in her heart that was causing that type of stroke. Tim Curry, a renowned British actor, we haven't seen him much in the limelight anymore. He had a pretty devastating ischemic stroke that left him wheelchair bound, but he's been able to regain his speaking ability and has been doing vocal work. Teddy Bruschi, sorry, I'm from Massachusetts originally. All right, Patriots, former Patriots football player. He was young. He was in his early 30s, was doing great with the Patriots, had one stroke, then had another stroke. And again, they found that similar to Hailey Bieber, that he had a hole in his heart that needed to be repaired, and that was what was causing his strokes. So hemorrhagic stroke, again, a bleeding stroke, 13% of all strokes. It's when that artery in the brain bursts, causing damage to that brain tissue. And like I said, it typically can be caused by aneurysms, but prolonged hypertension that's extremely severe can cause a hemorrhagic stroke, and certain types of drugs can cause a hemorrhagic stroke as well. So what are the risk factors for hemorrhagic stroke? The number one risk factor is uncontrolled high blood pressure. So again, making sure that when we're diagnosed with high blood pressure, that we're going to our provider and we're maintaining our medication regimen to keep that blood pressure well controlled. Other risk factors that increase your risk of hemorrhagic stroke: alcoholism, cigarette smoking, illicit drug use, blood thinners, okay, and some brain tumors as well. Now, what you'll notice here is that I don't have nearly as many pictures of hemorrhagic stroke survivors. And that is, as like I had said, there's a lot more people who die from hemorrhagic strokes than ischemic strokes. So Bret Michaels, 80s singer from Poison, he ended up having, he's a type 1 diabetic and ended up having a mini stroke that then was followed by a hemorrhagic stroke shortly after he had had his appendix out. Emilia Clarke, I think a lot of people know this, right? The mother of dragons from Game of Thrones. She was only 24 years old when she had a sudden onset of a really severe headache. Turns out she was having a hemorrhagic stroke from a burst aneurysm. Sharon Stone, similarly, she's been largely out of her acting career because she had a near fatal hemorrhage, similar to what Emilia Clarke experienced back in 2001. So I told you all about stroke and the causes of stroke. What do we want to look for when someone's potentially having a stroke? So again, I want us to come back to BFAST. This is acute onset. All of a sudden you have B, balance, loss of balance, new onset of really bad dizziness, okay? Eyes for E, vision changes. You're now starting to have blurry vision that's unexpected. Maybe you've had a loss of vision. Maybe you can't see out of one eye. F is for face or facial drooping. One side of your face is lower and drooping compared to the other side of the face. You may feel tingling or numbness on one side of your face. A is for arm, but we also mean arm and leg weakness. So one side of your body is weak or numb. And some patients have told me, oh, my arm just feels heavy. That's weakness, numbness. And then S is for speech, speech difficulty. Someone may be slurring their speech, having a hard time getting their words out. Maybe you're talking to them and what they're coming back with you as an answer makes absolutely no sense. These are all signs and symptoms of a potential stroke. A lot of times patients will go and say, oh, maybe if I take a nap, I'll feel better. Absolutely not. You want to call 911. Do not come to the emergency room by your car and sit. It's important to call 911 so that when you come to the hospital, you're prioritized over everyone else by going in via ambulance. So again, BFAST, balance, eyes, face, arms, speech, and time is of the essence to call 911 and get here via an ambulance. So what are some treatments for stroke? Can it be one symptom? It's very possible. And again, you know, one person was saying I had a major facial droop. So the challenge with stroke is that it's like guilty until proven innocent. We'd rather assume it's something severe and it not be than the other way around. So if I had a one-sided facial droop, I would make sure I'd call 911 and get to the hospital, because it could be a lot of other reasons, not necessarily just stroke. But if it was a stroke and you came here fast enough, you could potentially receive treatment for that. So yes, it can be one symptom. Thank you. All right, so those with an ischemic stroke, where there's a clot. We have two major options. So there's medical treatment, something called a thrombolytic or a major clot buster. And what this is is that it's very time dependent. It's a medication that breaks up any clot anywhere in the body, but it also goes and makes your ability to clot really hard to do so on purpose. And the biggest risk factor for this is bleeding anywhere in the body. That being said, it's a very time dependent treatment. So we ask commonly, when was the person last seen normal, meaning before those stroke symptoms occurred? And it's really important knowing that time, because we use that time of when last the person was seen normal to administer this medication. We have from last known well of 0 to 4.5 hours. So it's a very small window of time, which again is why we ask people to call 911 so that you can get here very quickly for potential treatment. There's also a lot of strict criteria to meet to ensure that you can safely get this medication. And so again, it's important to get to the hospital quickly with someone who knows your medical history, a list of medications to be able to assist us in quickly and safely identifying whether or not you or someone you love can actually get this treatment. There's mechanical treatment where they can go in and actually remove the clot. This again, it's time dependent. So studies have shown we can do this safely up to 24 hours since the patient was last seen normal. It's typically used only for really large clots, and it's very dependent upon where it is in the brain, because the area in which people can actually take that clot out, it's only in a certain area of the brain. Also, only certain hospitals in the area can do this. So this mechanical treatment is called a mechanical thrombectomy. It's very similar to like with those people who do when someone is having a heart attack. It's almost the same thing, but it's going to the brain instead. And so the hospitals in this area that can do this are comprehensive stroke centers, typically Johns Hopkins, MedStar Franklin Square, MedStar Georgetown, MedStar Washington Hospital Center. So not only is it time dependent, but it's also location dependent in the brain. The third option, if people come outside of the window of treatment here or are deemed not candidates for these types of interventions, they'll be admitted to the hospital to monitor for complications, ideally determine what caused the stroke, and how to mitigate those risk factors so that we can prevent a future stroke from happening. The recovery process starts right when you're here in the hospital with different therapies, with the whole goal to start the process of recovery with therapies and also to ideally prevent any further strokes from occurring. Because the unfortunate reality is that once you have a stroke, you have an increased risk of having another one. So hemorrhagic stroke treatments, what can we do? The first thing before we do anything is we manage someone's blood pressure. When a hemorrhagic stroke is occurring, it's very common to have someone's blood pressure extremely high as a way for your body to try and mitigate any issues that may be occurring during the stroke. So we really focus on very, very tight blood pressure control. If we can determine why someone is having this hemorrhagic stroke and is on possibly like a medication that thins the blood, we can give medication potentially to reverse the effects from that blood thinner. And ideally, we're going to obviously not have anyone on a blood thinner if they're having a hemorrhagic stroke. So I was mentioning earlier, if someone has those vessel abnormalities, special imaging at the hospital can determine where that bleed may be occurring and if that type of vessel abnormality is the cause. And so this person would be sent to another comprehensive stroke center, like I was saying, MedStar Georgetown, MedStar Washington Hospital Center, and such areas like that, where it's a very specialized surgery where they go in and they stop the bleed with surgery. The other thing here is that if it's a hemorrhagic stroke that's small, you may be able to stay here at this hospital where we are going to basically do medical management. And what that means is that we're going to very closely manage your blood pressure and really watch you to see that nothing further is happening from that small hemorrhage, because that's the only kinds of patients that we can treat here at our primary stroke center. Okay. Any risk factors that may have been identified, we'll manage those. Again, we're going to have early onset rehabilitation to ensure a smooth recovery process. And again, manage any factors to prevent a second stroke. Okay, so how can we decrease our stroke risk? So there are things that we call modifiable and non-modifiable risk factors. Modifiable risk factors are those things that we can manage to help decrease your risk of stroke. So high blood pressure, we can administer medication to help control someone's blood pressure. We can help set you up with smoking cessation programs to help you quit smoking. Can manage your diabetes with medications. We can administer medication that helps decrease high cholesterol, working with you to ensure a safe increase in physical activity and management of weight. We partner up with cardiology to ensure that heart disease is managed and that condition that predisposes you to clots, atrial fibrillation, is managed with medication as well. Drug and alcohol use, and when I mean drug, I mean illicit drug use. Again, we're going to encourage to reduce and stop that eventually. And then sleep apnea is another risk factor as well. So referring you to an ear, nose, and throat specialist and potentially interventions to help combat that. Now, there's the non-modifiable risk factors. And this is the challenge. These are things that we can't change. As you get older, you increase your risk of stroke, unfortunately, okay? Your gender. So men are at increased risk of stroke in the younger population, but as we age, women end up having an increased risk of stroke, largely because women outlive men. Race. The African American population, indigenous Indian population, they are at higher risk of stroke. Family history, especially primary family history. So first degree relatives, if your parents or your brother or sister had a stroke, that increases your risk. And again, once you've had a stroke, that increases your risk of having another stroke. So again, how do we decrease the risk of stroke? We take your medications as prescribed, really making sure that you're monitoring your blood pressure regularly, that we're following up on appointments after discharge and even before, right, to prevent stroke, making sure we're getting our annual checkups, to improve our eating habits, right, more fruits and vegetables and whole grains, to be physically active. And what I'm not meaning to say, let's all go out and, train for a marathon. Walking can be some of the best exercise. Trying to decrease our stress and to quit smoking. So what can happen with life after a stroke? So rehabilitation, as I've been mentioning, right, it starts during hospitalization and it really addresses your physical needs. So physical therapy, occupational therapy, and speech language pathologists are here at this hospital to help with stroke recovery. Physical therapy focuses on safe discharge planning, identifying where someone can go to get the best recovery muscle, like strength-wise. Okay, occupational therapy helps to determine if there's any therapy that can be used to help with basic basic care of yourself. So occupational therapy is great with like those helping to like relearn how to eat if that's the case, to ensure that you can manage your own affairs at home, and just activities of what we consider to be daily living. Speech services for people who have trouble speaking or swallowing. They are great at helping with therapies to increase strength and getting back to a new baseline. Again, after a stroke, lifestyle modification is key. Again, as I was saying, risk factor management is critical. Symptom management, not just physical and cognitive, but also emotional. It's a very common thing to have fatigue, depression, emotional changes after stroke. And that's actually normal, unfortunately. I know a lot of my friends who are stroke survivors, they say, oh man, I have to have that nap in the afternoon. No one has to bother me. I have to have it. So listening to your body is important. And then of course, ensuring that you are promptly going to follow-up appointments with your primary care physician, any specialists, and there are support groups out there for assistance. All right, so some key takeaways. Again, be stroke smart, know the signs and symptoms of stroke. Time is critical, call 911 to get help. Know and control your stroke risk factors, and that understand that stroke recovery is a process. There's not one timeline that one person, everyone goes on. It's person dependent. Okay, and then I have one last video.
You know me. You see people like me every day. But would you know when to act if I suddenly felt lightheaded and the room started spinning? If I couldn't do the simplest things, would you know something was wrong? Or if I wasn't speaking clearly, would you know this is stroke?
Signs of stroke can be sudden and easy to miss. The moment something seems off, don't hesitate, call 911. Stroke, react, don't regret.
Great. And that is the end of my presentation. Thank you so much for having me. I'm happy to take any questions. My apologies for the technical difficulties in the beginning of the presentation.
I just wanted to say thank you. I had a TIA in January, and you know, it's just scary because like you said, it is a predictor for you know, for waiting for that possibility of the next, right? And
Yes.
luckily all the tests have come back negative. There's no you know, no reasonings, great blood pressure, great cholesterol, all those factors, there's nothing.
Yeah.
My neurologist at Georgetown has done, you know, extensive testing, blood testing, everything. So I do have the one test left, which is the T bubble study that's coming up. So it was interesting when you said the one famous person had the hole in the heart. So that's what they're checking for, because I did
Yes.
fly the day before the incident. So they're checking that hole in the heart. So that sort of, you know, was really good for me to hear, like someone had the same type of symptoms. So I just wanted to say thank you. This was very, very helpful, because when you're in the hospital having some of these symptoms, and it's very scary to now be in a level mind and go through it. I really appreciate your time and doing this.
Oh, absolutely. No, for sure. Yeah, I mean, that's so some really great athletes, like the one who was talking initially, you know, a lot of people have heart defects that you have no idea until something wrong happens, right? Or something goes wrong. And so heart defects can be one issue, and that's what they're looking for with that type of imaging of the heart, is to see if there's any holes in our heart. It's the same type of thing that actually happens with babies when they're born. There's a hole in the heart that is normal, and it closes pretty quickly after birth. But some people, it never does completely, and that can cause stroke for sure. So we won't know it until something happens, unfortunately. I see So thank you, Christy, for sharing your story. I appreciate that. And it's extremely scary. I mean, I may not look it, but I have a major increased risk of stroke with family history, medical history that happened with me, that came about after I had my daughter. I had her when I was 36, and a lot of genetic predispositions started coming out in me, for sure. So it's really challenging, be frustrating too. Absolutely. So Bilquis asks, what are some reasons that younger people, those in their 20s and 30s, have strokes? That's a really good question. There's a lot of different reasons. So again, some people can have genetic risk factors that they're not aware of, right? There can be what we were saying, like that hole in the heart. People aren't completely certain as to why some people may be having it when they're younger. And that's what's important in getting to the hospital, so they can run a lot of tests. They can look at your blood work. They'll image your heart. They'll look at the vessels in your neck with a ultrasound to see if there's any narrowing of those arteries or any clogs that are happening there. Again, there might be people who have a vessel abnormality that was there since birth and they didn't know it. So it can be a lot of different risk factors for why some people are having strokes earlier in their life. What we also noticed early in the pandemic, before, when it was pretty severe, those people who had like long COVID, we saw people with increased clotting disorders, and some of them were people who ended up having strokes from that. I know personally, I had a colleague of mine who ended up having 3 strokes. She was an observation nurse. She had 3 strokes when she got COVID from caring for patients, and that was her only predisposing factor. So yeah, a lot of different reasons, and that's one of the key things of coming to the hospital to get fully examined. Maria asks, what is the difference between Bell's palsy and a stroke? So Bell's palsy is a very focused nerve injury that only affects the part of your face where it shows that drooping of the face. It's not technically a stroke. It's a nerve injury, whereas a stroke can look like that, but it's because of a clot or a hemorrhage in the brain in that area that controls the face. I hope that helps. Great question. So yeah, we can't just assume you have Bell's palsy. Coming in here, it's important because they can do imaging and other tests to differentiate between Bell's palsy and stroke. Okay. So Christy was saying that's the same thing with her. They were wondering if it was Bell's palsy versus a stroke. Yeah, especially when it's a facial droop. That's one of the things you can't determine until you run a lot of different tests. So brain imaging, lab tests, getting a really good history to see, what were you doing right before then. It's all really important stuff, kind of medications you're on. Absolutely. Can autoimmune diseases cause predisposition to stroke? Yeah, for sure. Those patients who have lupus can be having increased risk of stroke. There's different autoimmune disorders that can affect your clotting and can be a common co-occurrence. Lupus, because it affects different parts of your body, like your heart, your kidneys, and when they don't function well, that can have a secondary cause with stroke. So yeah, some autoimmune diseases definitely increase your risk. Is it possible to have a stroke with no symptoms? Good question. I wouldn't say no symptoms. I think maybe I feel like we tend to overanalyze or underanalyze why something's happening to us. Oh, I'm just tired. Oh, it's because I feel different because of X, Y, and Z. So I don't really know if I would say that you could not have symptoms with a stroke. It's possible, but I would chalk it up more to us not recognizing it as a stroke. Thank you. Those are really great questions.
Are there any other questions? Oh, there's
Oh,
another one.
yeah, that was a really good question. Are you able to study someone's brain and see if they've had a stroke before? Yes. So when we do brain imaging, which is one of the first things we'll do when someone comes in with a stroke, is that we will do imaging of the brain, and if someone's had an old stroke, it'll actually show up on that brain imaging. So yeah, when you're like, is there no symptom? Can you have a stroke with no symptoms? I would argue that you have had a stroke and you just probably didn't recognize that some of those symptoms that you've been having or had in the past were actually because of the stroke. Is there a link between postural orthostatic tachycardia disorder and an ischemic stroke? Well, that's a really tough question. I am not certain. I'd have to get back to you. That's a really good question. I mean, it's definitely a heart condition that can affect things. I don't know if I've honestly seen a link between those two that disorder and stroke, but I'd have to get back to you and look at the research. Great question, Jennifer.
Does anyone else have any other questions they'd like to ask?
Yep. Can certain mental conditions cause stroke, like chronic stress, depression? Good questions. So I would say, like, so stress, that's a whole body response. There's different internal molecules. I don't want to really say too much, but there's different like internal mechanisms that are turned on when someone is very stressed. So I would say, physical stress, mental stress can precipitate as physical stress, and that can cause increased high blood pressure, right? And we don't necessarily know it. It can cause stress on your heart, things like that, it may cause you to not eat as healthy, that sort of things. I would say it causes other things that increase and potentially cause a stroke. Someone says, or is it more so the physical side effects of the mental conditions? Yeah, correct. Can you develop dementia as a result of having a stroke or strokes? That's a really good question. So I wouldn't necessarily say develop dementia, but symptoms that are similar to dementia. So there's different parts of your brain that when injured, someone can end up looking like they have dementia. People can have memory issues, cognitive slowing, because again, it ages the brain. Every untreated stroke, or if it's a very severe stroke, can truly age your brain a lot. So I would say it doesn't necessarily cause a dementia disorder, but it creates symptoms that very much resemble dementia. Oh, and there was someone else who was saying if there's other like autoimmune disorders that cause strokes. There's something that's called cerebral amyloid angiopathy. It's kind of something similar to Alzheimer's, dementia, but those actually increase, and it happens in the elderly population, and that increases. It's very commonly seen. People have like micro hemorrhages or small bleeds throughout their brain, and that can increase their risk of stroke. Okay. Does a stroke treated till age 30? Does a treated stroke still age your brain 30 years? No. So the idea is that there was research that showed that an extremely devastating type of stroke that can affect your whole entire hemisphere of your brain, or one side of your brain, if that was left untreated, because it causes permanent damage to such a large portion of your brain, that's where they quantified it as 36 years of aging your brain. The idea is that the quicker you treat a stroke before it's progressed, the less deficits or symptoms that you could potentially have that are permanent. So no, the idea is that if you treat a stroke, I mean, we've had patients who come in the acute phase, get treated for stroke with that thrombolytic, that medication, and come out as close to being normal as possible, which is impressive. Let's see, hold on. Is there a risk of stroke if you have brain aneurysms? Yes. So the challenge with brain aneurysms is that if they rupture, that causes that hemorrhagic or bleeding stroke. And so yes, absolutely, it very much increases your risk. If symptoms from an ischemic stroke in the pond area are still present 5 years later, what is likely that full and complete healing will occur in the future? I'm assuming Pons area is what you may have asked, Jennifer. So I never want to say like it's the end all be all after 5 years, because a lot of things play into how someone recovers from stroke. Age is one that can be in your favor. And there's a lot of other factors that we don't really completely understand yet. There's a term called neuroplasticity, where it's how quickly your brain can heal itself and allow for new connections to be made to kind of regain function that may have been lost at that time. So there's a lot of different factors that play into whether or not there's full recovery or not. And I think we have to redefine what recovery and healing actually mean. I hope that answers your question. Because the other thing too is that, physical therapy, occupational therapy, speech language pathology, really working with those different therapies can really help. Let me see what else. Questions. If an MRI of the brain shows moderate white matter disease, does that increase your stroke or dementia? What that means is that there's, it's part of the aging process. Does that increase the risk of stroke or dementia? I really can't say. What medications can make you more susceptible to a stroke? Again, when I said medications, it's really those who are on blood thinners. Oh yes, Pons. Okay, hang tight for a second. I'll get back to you, Jennifer. Medications that can make you more susceptible to stroke. So illicit drug use, especially cocaine, that is extremely devastating. Alcohol is a drug as well, and that can increase your risk of stroke. I had a family relative who did illicit drugs, drank heavily, didn't always have the best of diets. She ended up having a brain aneurysm rupture. And as they went to go and help save that control that one aneurysm, she ended up having multiple aneurysms again and again and again, until the point that we ended up having to withdraw care because her brain was just completely not functioning appropriately. So again, that's my biggest plug is don't do drugs. So yeah, the thing is that blood thinners just inhibit your ability to clot, and so if you did have a hemorrhagic stroke, it'd be really hard to completely control that bleeding unless you got to the hospital quickly enough. The pons is really challenging, Jennifer, because that's a really deep part of the brain. It's part of the brain stem. I have a very close friend of mine who had a pontine stroke probably about at least 10 years ago. He still has some balance issues, but he's also aged too. So just to realize that it's not so cut and dry, unfortunately, and everyone's a bit different. The caveat when I'm saying about blood thinners is that when you have an ischemic stroke, they'll actually put you on blood thinners to help reduce your risk of a clotting stroke. So that's the fine balance, right? Is that you're getting put on medications that can increase your risk of a hemorrhagic stroke, but it's in conjunction with managing your blood pressure and all those other risk factors as well. I hope that makes sense. These are excellent questions. Thank you so much. Any further questions?
I don't see any other questions in the chat. And if there are no other questions, I want to thank our stroke expert, Amy Swoboda, for sharing that invaluable information, insights and strategies on stroke and stroke prevention. We hope all of you found this presentation insightful. And if you are not already doing so, putting some of these practices in place. As always, a big thank you to the MedStar team and our community partners for your collaboration on this important initiative, and to all of you for joining us. So to, of course, see a replay of tonight's session or any of the other Ask Our Expert sessions, please visit any of our Facebook and YouTube pages. And we hope you'll join us again on May 23rd, where we will ask the gynecologist. So again, thank you for joining us and enjoy your evening.
Thank you so much, everyone. I appreciate it.